Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical, and today I'm talking about carpal tunnel syndrome. And so if you'll notice, each week I come on and we discuss a new topic. And so this week we have good little tips on carpal tunnel syndrome. And so what I'm going to do is discuss what it actually is, and then one care tip that could be beneficial for you to keep your symptoms at home if you discover that you have carpal tunnel that could be of help to you. So I hope this is educational, and then I'll get into some other additional tips that I'll get to at the end of the video. Okay, so when we hear carpal tunnel, and I know a lot of you have heard it, what actually happens is we get compression of the median nerve. And so if you look at this picture here, the median nerve, if you look at the wrist here, actually comes right through here on the outside of our hand around our thumb. Okay, and this whole nerve supply, as it starts branching, it goes to our thumb, our index finger, our middle finger, and then the inside of our ring finger. Okay, and so a lot of people want to know, well, why do I get it, or how does that occur? And so the majority of time what happens is the repetitive motions and stress, as we keep doing things the same, it continues to thicken. And so what happens is, if you, for instance, are an assembly line worker at a factory doing the repetitive gripping, same motion over and over, or if you have a desk job and you're typing and your wrists are in a flexed position or in a hyperextended state, you start stressing all the muscles, ligaments, and tendons around that carpal tunnel. And while it doesn't happen in one day, but over the period of years of doing that same repetitive motion is what starts thickening the tissues around here that'll get that mechanical compression on there. So a lot of the first signs and symptoms you'll experience are maybe numbness and tingling into those hands, and then even you'll experience some pain and paresthesia in there, like pins and needles type feeling. And so one thing that they found on the research that this topic goes in is actually wearing a wrist splint in the evening to alleviate some of those pains. So a lot of you may notice, if you have carpal tunnel, you'll experience it's really worsening when you go to sleep, and it wakes you up, and so it's very frustrating. And so if you have at home a wrist guard or a splint, be sure to wear that, and it has shown that it actually not only reduces the symptoms but improves your functioning. Okay, and so that's one little tip that could help keep your symptoms at bay. I would also encourage you to tune in next week, as I'm going to go into an additional tips that you can do at home that may be very beneficial to you if you have them, to get that progress even better and reduce those symptoms even more. So I hope you guys found this helpful. Be sure to comment in the section below this video and reach out to us if you have any questions about carpal tunnel and what we can do to help. As always, have a great rest of your day.